Dear students, this is Dr. Pooja Thakkar from Inside Biology. We are in the last session of reproductive health. In this particular session, we need to discuss regarding medical termination of pregnancy and sexually transmitted diseases. They can be also considered as MTP and STDs. Now, what do you mean by medical termination of pregnancy? Medical termination of pregnancy or MTP is also known as induced abortion. It is the medical way of stopping the unwanted pregnancy. Pregnancy termination is performed in the first trimester is safer as it has fewer complications, as we all know, than in the second trimester. Now in India, the national average sex ratio is 914 girls to every 1000 boys. That is 914 girls to 1000 boys. The families want son rather than daughters, as son bring in a dowry when they marry. During pregnancy, at the 20th week, amniocentesis is performed. Now, what is that technique? It is a technique where the amniotic fluid is taken from the mother to analyze any sex-linked disorder in the newborn baby. The process of amniocentesis is usually performed after 15th week of pregnancy when it has only 0.5% risk of miscarriage. The risk is higher if that is conducted before 15 weeks. Apart from that, the analysis of a genetic disorder, amniotic cells can also be utilized to identify the sex of fetus. This technique is misused in India for sex determination and for the female feticide, that is the death of baby girl or female child. Thus, Indian government has made the MTP illegal after 20 weeks of gestation or pregnancy, as they want to make the ban on the sex determination more effectively. It is compulsory for women to have counseling before abortion, especially in order to determine their motives. Now, MTP is performed due to many reasons. They can be the failure of contraception, a pregnancy that is hazardous on the physical or mental health of a mother, a pregnancy which is caused by a rape, or it is complicated health issues of growing fetus. Now, this particular kind of MTP can be performed both ways, that is surgically as well as non-surgically, depending upon the gestational age of a female, which pregnancy month is going on in a particular lady. Now, surgical MTP procedures are carried out under anesthesia condition. Due to the surgical procedure, the patient can have a lot of bleeding during and after the procedure, and it is associated with high chances of recurrent abortions. In few cases, the patient may not conceive again if infection sets in. Now, these are varieties of surgical techniques. First is surgical technique by vacuum aspiration. Vacuum or suction aspiration uses the aspiration to remove the uterine content out of the body using a particular kind of instrument that is termed as cannula through the cervix of a female. Now, the anesthesia injection is made in the cervix to numb it, and then the suction is applied through the cannula that is inserted into the uterus and that is connected to the source of suction. The source of suction can be either electric pump or handled syringe. The cervix does not need to be dilated for this particular process, and it is the most commonly used process for abortion during the first 12 weeks of pregnancy. In this particular diagram, you will be able to notice the vacuum aspiration technique in which the cannula has been used, which has a very narrow end that has been inserted through the cervix into the uterus to provide suction by using suction pump. Now, the next technique is a dilation or the evacuation process. In the second trimester, more than 13 weeks of pregnancy, dilation and evacuation technique can be utilized, that is in short termed as DNE method. The cervix is prepared and dilated so that it is not injured in the procedure. A dose of medication such as misoprostol is provided so the uterine tissue will get softened. Later that the healthcare provider injects anesthesia to the cervix region and swab the vagina and cervix with a gripping tool. Sometimes forceps or other kind of medical tools or devices can also be used to scrap the uterine tissue which are there inside. This is why the procedure is also commonly called as DNC, that is dilation and curettage. In the next diagram you will be able to notice the curette which will be utilizable here to scrap the uterine tissue, and that will evacuate out the fetus through the cervix. Now we will discuss regarding non-surgical methods. These are several drugs-based methods which can be prescribed alone or in combination to terminate early pregnancies. These include hormones like prostaglandins, oxytocin, and anti-progesterone hormone or methotrexate. These drugs can be collectively termed as abortifacients, that is, they are causing abortion. Now, first we will describe prostaglandins. Prostaglandins are physically active lipid compounds that are naturally produced by the body during the injury or illness. They are also involved in the induction of labor. These drugs can be used vaginally as well as orally for the abortion process. Now, the next is oxytocin. High doses of oxytocin hormone are given in small volumes in the intravenous fluid, as oxytocin causes uterine contraction and that will induce early labor. That is what we want right now for the block of pregnancy, or that is for the abortion process. Now the next is anti-progesterone. We already know that progesterone is very necessary to sustain the pregnancy. So now anti-progesterone drugs are blocking the action of body's hormones, that is progesterone, which is very important for pregnancy. Misoprostol and mifepristone are commonly used drug to induce labor. Now methotrexate, the last one, it is a folic acid antagonist. Folic acid is mandatory for the baby's brain development, so it is working in the antagonist way of folic acid. This is a drug that will stop the cells of a fetus from dividing. So this is all about how we can stop the pregnancy or how we can do the medical termination of pregnancy. Now here we need to discuss regarding sexually transmitted diseases. This is very important. Sexually transmitted diseases or sexually transmitted infections, STDs, can also be termed as STIs. They are known as venereal diseases. These are amongst the most common infectious diseases, and their epidemiological profiles vary from country to country. STDs are major concerns for the developing countries, specifically India, where people lack sex education. And how to prevent STDs they don't know, and how to maintain the good reproductive health. Now we need to focus here that which are the infectious organisms behind it. So STDs involve the transmission of an infectious organism between the sex partners. Depending upon the disease, the infection can be spread through any sexual activities involving sex organs, the anus or the mouth. The second cause may be an infection can also spread through the contact with the blood or any cut part where the bodily fluid are exchanged. And the third reason may be sharing of unsterilized needles that can also markedly increase the chances to pass STDs to others. Now STDs can affect men and women of all the ages including children. There might be a condition where people can pass STDs to their partners even if they do not show any symptoms. Women are specifically more severely affected by STDs. They can have the pelvic infections such as pelvic inflammatory diseases, that is PID, that may lead to tubo-ovarian abscess, which might result in ectopic pregnancy, that is the development of fetus outside the uterus anywhere around. That can be in the fallopian tube, that can be near the cervix, that can be super dangerous for the women. And that can also cause, that PID can also cause infertility to the particular women, or even death for a woman. Many STDs are hereditary and that can pass from a mother to the baby. So before planning for a baby, any kind of STDs or any kind of HIV infection is there or not in a couple, that has to be checked. Now, STDs can caused by varieties of viruses as well as bacteria. More than 20 different STDs have been identified. The first one is by chlamydia trachomatis, which can induce chlamydial disease or chlamydia disease. The second disease is gonorrhea, which can be caused by Neisseria gonorrhea. Third is syphilis, which has been caused by Trypanosoma pallidum. The fourth disease is genital herpes, which is caused by herpes simplex virus, that is also termed as HSV. The fifth is genital warts, which has been caused by human papilloma viruses, that is HPV. The sixth one is HIV or AIDS, which can be caused by human immunodeficiency virus. And the last, human papilloma virus infection, which is also considered as STD, because that can lead to cancer of cervix. That is, HPV infection may lead to cervical cancer. Now, usually in about 80% of women and in 50% of men, there are no visible symptoms of these kinds of diseases. However, people suffering from STDs often have painful ulcers on the genital area. That can be the significant identification mark. Now, commonly there is a discharge from the vagina or the penis and some kind of burning sensation or pain during the urination. Often women with STD have an ectopic pregnancy, as we have already discussed, infertility issues, or they might have potentially serious complications. So, prevention is the best strategy that can be employed to prevent these kinds of infections. So, always avoid intercourse with a partner having genital sores, rashes, or discharge. Use latex condoms during coitus or sex. Always get tested for HIV or any other kind of STDs and take full treatment. So this is what all about MTP and STDs. I have given one link here, you can copy it and search for varieties of STDs as well as their symptoms. Thank you.